Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment. Right? Some of the larger agencies are succeeding, and that's because that they actually created a sales process, created a training program for their marketers out there to know what they need to market. And the company is making sure that they provide information to the marketers, to the marketing team, to the sales team, so that they are knowing who to target specifically. And there are ways to be able to do that. And we're going to share that with you in this training series as we're doing it, right? So they have these full-time marketing managers, and if you're a small mom and pop agency or a medium-sized agency, maybe you cannot make sense of actually having a full-time marketing manager, right? Maybe it's you as the owner who's trying to monitor the team. Maybe it's you as an administrator, working for the company, leading the team. But here's what we find a lot, and that is if you cannot really focus directly on your marketing, you're not going to see some success. And we can't just rely on our marketers to just do what they need to do out there. We need to provide them education. We need to provide them training. We need to provide them materials on what's going to be able to work out there, okay? And I'll tell you guys a lot. This is that marketing nowadays is completely different how we market our companies 5, 10, 15, 20 years ago. Yet most agencies are still running their agencies, their marketing strategies like it was the year 2000. And that right there, my friend, is going to be probably the beginning of failure for a lot of the agencies out there, okay? So you don't really need to have that, but you need to be able to know what your marketers need to do. You don't need to have a marketing manager. Or some agencies actually out there, they can't afford paying somebody $70,000, $80,000 for a marketing manager, and they use my team to be able to monitor their marketing team, give them the right strategies, give them who they should be targeting, and then in turn, we actually talk to the owners and the administrators and report to them. So the marketing team reports to us, and we report to the owners and administrators so that we can have some form of a dealing, and you don't have to pay the $70,000, $80,000, or even I've seen marketing managers make about $150,000 a year as well. And this is for home health, for home care, or even hospice agencies. Now, the first step in prospecting, and this is something you need to pay attention because once again, we're beginning in the prospecting phase. And this is actually to do what we call a competitive analysis or a competition matrix. Okay, you need to be able to first of all see what your competitions are doing, right? And you need to be able to match these things. And the reason why you want to do this is you want to see what these top agencies are actually doing out there that's, creating successes. And, later on in this video, I'm going to share with you guys how you can actually even find out who are the top agencies in your area. There are softwares nowadays, or there's ways you can look into, government websites to figure out which agency is actually receiving the most referrals in your particular area. And so by you being able to see these type of agencies and see what they're doing, you can then, pretty much what we call reverse engineer these agencies and go after the agencies that are doing really well, and then seeing what they're doing that makes themselves stand out. That's maybe you can use for your company as well. So you want to be able to do a competitive analysis, okay? And the best way to do that, like I said, is to be able to use softwares, or you can do what I used to do back in the days, which was using data.gov or going through Google and going manually to their websites and figuring out what they're doing. Now, in the competitive analysis that you have to do, or competitive matrix, I'm sorry if I'm, blubbering here, but within those, there's going to be several things that you need to look at, and that is the pricing, programs, and services, right? These are three things you need to pay attention on because this is how companies can differentiate themselves. Remember, if you're a home care company, you're probably providing the same services, homemakers, caregivers. If you're a home health agencies, you're probably providing skilled nursing, physical therapy, occupational therapy, speech therapy. Same services. But the thing though is, how can we make ourselves stand out? So for example, pricing. Let's talk about home health for now, medical home health. Well, do you accept Medicare? Most agencies will. But the question is, are you accepting Medicaid patients? Are you accepting private insurances? Okay, these are things you need to also look into, right? Because if you're competing against another agency and they're accepting all these insurances and all you want is the Medicare insurance, the Medicare payments, well, guess what? There is a differentiator right there and then. Now, I truly understand a lot of you guys are going to say, well, Michael, there is no money in non-Medicare patients. And I can completely agree with that. But here's the thing. There are a lot of agencies that are actually thriving by not accepting majority Medicare patients. And that's where you would have to work in your organization to figure out a way that, are you paying your nurses too much? Is your expenses within the office too much? Are there things that you can actually take care of to be able to reduce that so your operations, costs will drop down, which makes sense that you can actually make money or a little money from non-Medicare patients. Brought to you by our partners at HomeCareAnsweringService.com and MedicationReminderProgram.com. So MedicationReminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, HomeCareAnsweringService.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have HomeCareAnsweringService.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.